¿Cómo estás, mi familia? Okay, I just being silly, sorry. All right, everybody, hello and welcome to Candida Vulvovaginitis. Like with my other STI, sexually transmitted infection presentations, please focus on the bugs and the drugs. Just get into it. It's a quick presentation. A little bit of intro background. This is the candidiasis, is one of the most common causes of vaginal itching and discharge. So it's characterized by inflammation. And the treatment is used for symptomatic relief, so to treat the symptoms. Treatment for relief of symptoms, about 10 to 20% of reproductive age women harbor the Candida species, are asymptomatic, and it is not recommended to treat these women. So really, with your patients and for my exam purposes, board purposes, etc., you're just going to be treating these patients who have symptoms, complaining about symptoms. And that's probably, I mean, honestly, if they are asymptomatic, they're probably not going to come see you in the clinic. So, you know, it's the people that come to the clinic. Whoa. All right. Sorry about that. That was technical difficulties. My speaker almost blew up. Okay. That was crazy. Sorry about that. I got everything silenced now and stuff. I sometimes use this other... Oh man, I use these like Bluetooth speakers to listen to music sometimes, and I sometimes forget to turn them off. I'm really sorry, but hopefully that wasn't too loud. It was super loud over here, and that was genuine fear that you heard in my. I was really like I jumped back in my seat there, so sorry about that. That is unprofessional. Oh my goodness! Wow. Okay, my face is hot now. Jeez. All right. Yeah. Sorry about that. I get embarrassed, even though I'm just recording for you guys at my home. I'm still getting embarrassed stuff. So yeah, I'm all flushed now, all embarrassed, all hot and bothered. Okay. Whew. Got to cool down. Open up a window. Man, that really scared me. I'm like my mom. I scare really easily, but my daughter always thinks she'll like hide around the corner, like jump out and like I'll scream really loud and jump back. My wife's like, "Are you exaggerating?" I'm like, "No, she really scared me. I don't expect this little short 4 or 5-year-old, 4 or 5, she's about to turn 5 in like a week. This little 4-year-old just like hiding behind a corner and just jump out and scare me." But anyways, all right. So yeah, you're going to want to treat your symptomatic patients. Oh, okay, to relieve symptoms. Asymptomatic women and sexual partners do not require treatment. Let me edit that a little bit. It looks a little bit better like this. So asymptomatic women, sexual partners, not required treatment. So again, it's just people that have symptoms. So really, does that mean people that are coming to see you? So there's a lot of oral and topical preparations that are available over the counter and in single dose regimens. So I'd encourage you guys, as always, with over the counter preparations, just I know you guys don't have free time, but when you have some free time, go poke around in the over the counter section, go check it out. You know, it's for your education and see what they have out there. But anyway, so they have, and those will be on the next slide, next table. As far as what is going to be the one you go for, it's parts of this on patient preference, contraindications, cost, ease of access. So is it easier for them to get it without a prescription over the counter or not? Do they like oral? Do they prefer an oral medication? Do they prefer a topical administration? It's just really going to kind of depend. One quick note on here too, that as far as like a drug-free remedy, you can also use a yogurt. So like a unflavored, full fat, just normal yogurt. Women historically and other cultures will use yogurt inserted vaginally to help with their this candidiasis infection. So that's something else you might come across. I've come across it a couple times in the pharmacy when I went to school, worked in Austin, Texas, and then in Tulsa, Oklahoma. There are a couple times, So it may be kind of fringe. I don't know if you're going to come across patients, but just heads up, FYI on that. It's not recommended. It's not evidence-based medicine, but it's just something I just want to mention that you may come across that with some of your patients. Again, depending on their culture, background, if they're interested in kind of a non-pharmaceutical agent. But anyways, great table here. Definitely make sure you pay attention to this, study this. You'll notice that you have a lot of different products here. We have the brand names and generics. Just focus on the generics for studying purposes. And then you'll notice here the preparation. So you'll notice that the fluconazole, diflucan, is the oral or by mouth. Practitioners and women will prefer this, or men too, because it's a one-time dose by mouth. So it's pretty easy as far as taking it is concerned, versus some of these other ones will be, you have to use for multiple days. They do make some topical preparations that are 1 day. So like Monostat 1 is the brand name for miconazole that you can get this over the counter. You may have seen commercials for it or ads or whatever. Where Monostat 1 is just, it's a vaginal suppository that's just a one-time thing, a 1 day thing. So, and again, some women prefer that. One advantage of that too, you can't just go to your whatever H-E-B Walgreens and go buy that. Versus diflucan or fluconazole, you would need a prescription for, so you would have to see your practitioner. So maybe, but anyways, read through this. Make sure you know the generic names for testing purposes. And then because there's only one by mouth, please know that fluconazole diflucan is available for prescription by mouth, and then know that the other ones are topical. However, I will not make you guys memorize, or I'm not expecting you guys to memorize the preparations and the dosaging. You don't have to worry about, excuse me, memorizing that. And then you'll notice too that it has a column here for, does it require prescription? Yes or no. You notice, like I said, Monostat 1, no prescription. It's a one-time suppository. They're popular as far as what we sell in the pharmacy. We'll sell these, and again, just kind of depends on the patient preference and stuff. Some women don't like this; they prefer oral tablets. Some women are okay with it. It's just going to depend on your patient. So definitely for testing purposes, make sure you are studying these generic medications. It's pretty straightforward. They're all azole. They're all antifungals is what I meant to say. I'm sorry. All antifungals, which makes sense. You're trying to treat a fungal infection. So you want to make sure, and the treatment regimen and these recommendations are based on uncomplicated versus complicated. So the majority of your patients that are symptomatic are going to have uncomplicated infections versus complicated. And we have the criteria here. Don't worry about studying this for my exam and memorizing it, but it may be beneficial for ICM. I just put it in here for completeness sake. But again, majority of your women are going to be uncomplicated. So here is more as far as the criteria. For uncomplicated, they suggest single dose of fluconazole by mouth or the multi-dose and topical regimens. So go back to that table and refer to those as far as their first line agents. And so basically it's any of these on this table are considered first line for uncomplicated. Again, the specifics will be dependent on the patient. And for exam purposes, for testing purposes, I will make it clear cut. So for example, it's a woman who doesn't like taking things by mouth. Let's say this is that you do with the Monostat 1, or if someone doesn't want something vaginally, it's going to be pretty clear cut. Or it'll be, of the answer choices, there's only one antifungal, or, that one of these antifungals is on the list, and then there's other stuff as far as answer choices that are on the list. I will try to make it as clear cut as possible for exam purposes. Complicated infections. These require longer course of therapy. So specifically here, you can read through this. Treatment of complicated vaginal candidiasis. You'll notice to have much longer treatments. So for example, oral fluconazole, 2 to 3 doses. Topical azoles up to 14 days. If it's recurrent, it can be up to maintenance doses for up to 6 months. So again, just read through this. Don't stress too much about memorizing all the details of the dosing for me. Just know which drugs are mentioned here for the complicated, and then just be, just read through it. I want you guys to know that if majority you're going to see, or 90% of the majority you're going to see that are uncomplicated, but for those rare ones you may see on your rotations, just know that you basically go with the same drugs. It's just going to be a longer duration of therapy. If the women have severe symptoms or immunocompromised, they suggest fluconazole, 2 sequential doses given 3 days apart. And that is preferred over the topical agents. Again, this is for complicated. If they have Candida glabrata, they suggest an IV boric acid. Intravaginal. It's IV, but it's a different type of IV. I shouldn't use that abbreviation. So intravaginal boric acid for 2 weeks. You can alternatively do nystatin pessary, which pessary just means it's like a suppository that's inserted vaginally. So nystatin pessary daily, amphotericin B, or flucytosine. If you suspect, or if they have Candida krusei, topical azole, cream suppository other than fluconazole, because it's typically resistant to fluconazole, And so then in that instance, if you have this specific infection, which again, I'll list that on exam, or hopefully on your board exam, it'll be listed explicitly. But so there is resistance with fluconazole with Candida cruzi. So then you'll go with clotrimazole, miconazole, or tericonazole. For pregnant women, they recommend a topical azole, so clotrimazole or miconazole, rather than nystatin or the fluconazole by mouth. So you're going to want to go topical for pregnant women, clotrimazole, miconazole. And this is because basically that some birth defects have been noticed. If they have recurrent vulvovaginitis, suppressive maintenance therapy rather than treatment in the episode. So what they do is they recommend fluconazole 150 milligrams every 72 hours for 3 doses. Then a maintenance dose, 150 milligrams, once per week for 6 months. So it's much longer therapy there. And with those women, they need, with recurrent infection, should try to eliminate or reduce risk factors for infections. Incidence of fluconazole allergy in women is unknown and uncommon, so you typically don't have to worry about that. But if they do have a true allergy to it with heavy angioedema, cedar rash, you can then try the miconazole or the clotrimazole. So that is it for that presentation. Another quickie. Again, focus on them bugs and drugs. You already know. Thank you guys for your time and attention. As always, if you have any questions, please feel free to email me. Questions, comments, feedback. Talk to you guys later. Bye.